Most people think more checkups mean better health, especially as we get older. But what if I told you that after age 70, some of the most common tests could actually cause more trouble than they prevent? I know it sounds backward, but it's true. Some checkups, the ones often pushed as routine, might expose you to stress, unneeded treatment, and side effects that you didn't sign up for. More and more health experts are urging seniors to stop and think before saying yes to every scan or screening. This video takes a calm, clear look at 5 health checkups that often do more harm than good past a certain age. These are the kinds of tests even seasoned doctors hesitate to get for themselves in their later years. We'll walk through the real risks, why they're still so widely offered, and safer paths you might want to consider. If you're over 70 or love someone who is, this might just change how you approach your next doctor's visit. Let's get started. Number 1. Bone density scans for everyone. Bone density tests, or DEXA scans, are often treated like a must-do for everyone over a certain age, especially women. The goal is to catch early signs of osteoporosis before a fracture happens. Sounds reasonable, right? But what most people don't realize is that these scans can sometimes cause more anxiety than benefit, especially when they're handed out automatically for no real reason. If you've never broken a bone, don't have a strong family history of osteoporosis, and live an active lifestyle, the scan might not give you any helpful information. What it may do instead is slap you with a diagnosis of osteopenia, a fancy word that basically means your bones are a little thinner than average, and from there, you could be pushed toward medication you might not need. That's where things start to get tricky. Once someone hears they have thinning bones, panic often kicks in. Doctors, wanting to be proactive, may prescribe drugs like bisphosphonates, Fosamax, or Boniva, for example. These medications are designed to slow down bone loss, but they can come with side effects that aren't always discussed up front. We're talking about severe joint or muscle pain, acid reflux, and in some rare cases, bone problems in the jaw or femur. And here's the kicker. These medications aren't always necessary for people with mild bone loss. For many seniors, especially those without fractures or other risk factors, lifestyle changes like strength training, walking, and getting enough calcium and vitamin D might be just as effective without all the side effects and hassle of medication. I remember Clara, a 74-year-old retired nurse who stayed active by tending to her backyard garden every morning. She had never broken a bone, never had trouble with balance, and felt strong and steady. But during a routine physical, her doctor suggested a DEXA scan. The results came back showing early signs of bone thinning. Even though she had no symptoms, the doctor prescribed her a daily pill just in case. Within a few weeks, Clara began having aches in her hips and knees and stopped spending time outside. The pill made her feel stiff and sore. She no longer had the energy or confidence to move the way she used to. Eventually, she stopped the medication and switched to resistance band exercises, leafy greens, and gentle hikes. Her energy came back, and so did her independence. Her story isn't unusual. It's a reminder that a number on a scan shouldn't define how we treat our bodies. So if you're over 70 and your doctor recommends a bone density scan, ask why. Ask whether the results will actually change your care. And if you're already eating well, moving regularly, and haven't had any fractures, it's okay to wait or even pass on the scan altogether. After all, your body is a number. And healthcare at this age should be more about protecting your quality of life, not chasing problems that don't exist. Being cautious isn't the same as being careless. It's about knowing when to pause, ask questions, and trust your lived experience. Not every scan is a solution. Sometimes, the best care is choosing what not to do. Number 2, routine PSA tests in older men. The PSA test, short for prostate-specific antigen, is one of those screenings that's been pushed for decades, especially among older men. It measures a protein made by the prostate, and higher levels can be a sign of prostate cancer. Sounds like something you want to stay on top of, right? The problem is, the test isn't always that straightforward. PSA levels can rise for a lot of reasons besides cancer, like inflammation, an enlarged prostate, recent sexual activity, or even just getting older. But once that number comes back a little high, the system kicks into gear. More tests, more appointments, more worry. For men over 70, especially those without symptoms. It can send them down a road they never needed to be on in the first place. What often gets overlooked is that most prostate cancers in older men grow incredibly slowly. Many of them never cause problems, never spread, and never even show symptoms. Yet the moment a PSA level is flagged as elevated, panic sets in. The patient is sent for a biopsy, an uncomfortable and sometimes painful procedure that can lead to infections or bleeding. If cancer is found, even if it's small and non-aggressive, treatments like surgery or radiation are quickly discussed. And those treatments carry serious risks. Incontinence, erectile dysfunction, long recovery times, and emotional stress that doesn't just affect the patient but their entire family. That's a steep price to pay for something that may never have been a threat to begin with. Let me tell you about James, a 76-year-old retired plumber who lived a quiet, content life with his wife in Michigan. He felt fine, stayed active, and had no urinary issues or pain. During a routine checkup, his doctor offered a PSA test. James said yes. He figured, why not? The result came back slightly elevated. That one number kicked off months of appointments. A biopsy was done, and it showed a small, slow-growing cancer. Even though his doctor told him it might never progress, James couldn't sleep at night thinking about the word cancer. He chose surgery. The recovery was tough, and he ended up dealing with long-term side effects that affected his quality of life much more than the cancer ever would have. Looking back, he often said the test caused more harm than the diagnosis itself. Now, none of this is to say the PSA test is bad across the board. It has its place, especially for men who are younger, have a family history, or are experiencing clear symptoms like pain, trouble urinating, or unexplained fatigue. But for otherwise healthy men over 70 who aren't having any issues, the benefit of catching a slow-moving cancer is often outweighed by the mental, emotional, and physical toll that comes with the follow-up. It's a personal choice, yes, but it should be an informed one. So before you agree to another PSA test, just to be safe, ask what it's really for. Will it give you peace of mind, or start a spiral of tests and treatments you might not need? Sometimes the smartest move is to stay alert to symptoms. Talk honestly with your doctor, and skip the screenings that don't make sense for your stage in life. Being wise about your health doesn't mean doing everything. It means doing what's right for you, calmly, confidently, and on your terms. Number 3, repeat abdominal ultrasounds for aneurysm checks. If you're a man over 65 who's ever smoked, chances are you were offered an abdominal ultrasound to check for an aortic aneurysm. That's a one-time scan designed to spot a bulge in your main abdominal artery that could, in rare cases, rupture without warning. It's a good test once. But here's where the confusion begins. After getting that first clear scan, many seniors keep getting follow-up ultrasounds year after year just to be sure. And unless your doctor found something worth tracking, these repeat scans can quickly become more of a problem than a precaution. Most small aneurysms found in older adults don't grow fast, and many never grow at all. And yet, even a small finding, something like a mild widening of the artery, can spark fear and trigger a cycle of rescanning every 6 months. That leads to more worry, more hospital visits, and eventually pressure to take action on something that might never cause harm. I met a man named Carl, 75, who had a perfectly normal scan at 67. Still, he asked for another at 70, then again at 72. The third scan showed a slight bulge, nothing urgent, but it unsettled him. His doctors weren't even alarmed, but he insisted on surgery just to be safe. That procedure led to complications, including an infection that put him in the hospital for 2 weeks. He later admitted the fear of what might happen pushed him to fix a problem that wasn't really a problem at all. There's a bigger lesson in stories like Carl's. Medical tools are powerful, but when they're used without a clear purpose, they can pull people into unnecessary risk. Repeated aneurysm scans in seniors often don't improve outcomes, especially when the original test was normal. And even when they catch small changes, acting on them isn't always the safest route. Surgery for abdominal aneurysms is no small matter. It carries real risks, especially in older bodies. There's anesthesia to consider, healing time, the strain on the heart, and the emotional toll of recovery. And sometimes, The surgery causes more complications than the aneurysm ever would have. This isn't about avoiding care. It's about being thoughtful with it. If your first scan was clear and you're not showing any signs of pain, pressure, or changes in your belly area, you might not need to keep going back for more. Staying healthy after 70 isn't about living under a microscope. It's about focusing on what actually improves your day-to-day life. Movement, connection, nutrition, and sleep. Things that make a real difference you can feel. So if a doctor suggests another abdominal ultrasound, pause and ask, why? What are we looking for? And how would the result change anything? That kind of question doesn't make you difficult. It makes you wise. You have every right to know whether a test is worth your time, your energy, and your peace of mind. Sometimes reassurance doesn't come from a machine. It comes from understanding your risk, trusting your care team, and refusing to be dragged into a cycle of chasing shadows. Number 4, annual skin cancer screenings without risk factors. Skin cancer is a serious condition, and when caught early, it's often treatable. But here's where the conversation gets a little off track. Many older adults are told they need yearly full-body skin checks, even when they've never had a history of skin cancer, rarely spend time in the sun, and don't have any concerning spots. If that sounds like you, these routine screenings might not be doing much good. In fact, they can lead to unnecessary biopsies, stress, and a whole lot of healing time that takes longer than anyone expects, especially after 70. Let's break it down. A full-body skin exam sounds harmless enough. You go in, get checked from head to toe, and leave with peace of mind. But for seniors, it's often not that simple. As we age, our skin naturally changes. New spots appear, old freckles shift, and dry patches become more common. These changes aren't always dangerous, but they often get flagged anyway. Once something is labeled as suspicious, the next step is usually a biopsy. That might involve shaving or cutting the skin to send a sample to the lab. Now, for someone younger, that's a minor thing. But older skin heals slower, bleeds more easily, and is more prone to infection. One small biopsy can turn into weeks of soreness or bandage changes, sometimes even scarring or follow-up procedures that weren't really necessary. Take Nora, for example. She's 78, fair-skinned, and has never had a single skin cancer in her life. She rarely goes outside in peak sun hours, wears a hat when she gardens, and has no family history of melanoma. But every year, she gets nervous and books her skin check. At her last appointment, her dermatologist found a tiny brown spot on her shoulder, one that Nora had had for over 10 years. The doctor recommended a biopsy just to be safe. The results came back benign, but the biopsy left her with a sore spot that took over a month to heal. During that time, she stopped going to her weekly swim class because the wound was too sensitive. All that stress, time, and disruption for something that wasn't even a threat. Now, this doesn't mean skin checks should be ignored. If you notice a new mole, a sore that won't heal, or something that's bleeding, itching, or changing in shape or color, those are things you absolutely should get checked. But when you've had no history of skin cancer, no symptoms, and no clear risk factors, you might not need to schedule a full body screening every single year. It's okay to space them out or skip a year based on your personal history and your doctor's input. So, before you book that annual appointment out of habit, ask yourself, has anything changed on my skin that I've noticed? Do I feel good? Has my doctor ever found something concerning before? And most importantly, will this check actually give me new information, or is it just another box to tick? The goal isn't to ignore your skin. It's to stay mindful of it without jumping into a loop of tests and treatments that may not bring real benefit. After all, your health isn't about being hyper-alert to every freckle. It's about making sure your care actually helps you stay comfortable, independent, and enjoying life. Number 5, automatic medication reviews that lead to new prescriptions. Medication reviews are supposed to help simplify your treatment, especially as you age. But for many seniors, they end up doing the opposite. You go in expecting a checkup on what you're already taking, and you leave with 2 or 3 new prescriptions you didn't ask for. It happens quietly and often with good intentions. A pharmacist or a clinician notices a borderline number in your records and recommends a pill just in case. Before you know it, your medicine cabinet's overflowing, and you're dealing with side effects you never had before. The truth is, once you hit your 70s, your body handles medication differently. Your liver and kidneys don't clear drugs as fast, and your body becomes more sensitive to even small doses. Adding new medications, especially without clear symptoms, can do more harm than good. One pill to lower cholesterol, another to prevent blood clots, and maybe one more to manage blood pressure that wasn't even causing you issues. On paper, it looks like prevention, but in reality, it can lead to dizziness, fatigue, poor appetite, and even dangerous falls. And here's the problem. Once these new prescriptions are added, they're rarely reviewed again. People just keep taking them, sometimes for years, without ever questioning if they're still necessary. Let me tell you about Robert, an 82-year-old retired school principal. He was sharp, active, and still drove himself to the grocery store every week. During a routine visit, his clinic suggested a comprehensive medication review. Robert had been doing just fine on 2 prescriptions he'd taken for years. But after the review, they added a blood thinner and a statin, because his age and numbers fit the guidelines. Within a month, he was feeling off balance and bruising easily. One morning, he lost his footing and fell in the kitchen, hitting his head on the counter. He ended up in the hospital, confused and shaken. The irony? His fall was likely caused by the very medications meant to keep him safe. This isn't about blaming doctors or pharmacists. They often follow national guidelines that are designed for large populations, not individuals. But that's exactly why we need to speak up. Medical care in your 70s and 80s should be about fine-tuning, not piling on. Before accepting new prescriptions from a medication review, ask your provider, what's this drug for? Do I have symptoms this is treating? What happens if I don't take it? And will this improve how I feel or just tweak a lab number? These questions aren't pushy, they're practical. And they might just protect you from taking something your body doesn't need. There's absolutely value in reviewing your medication list, but the goal should be trimming it down, not bulking it up. Fewer medications often mean better focus, fewer side effects, and more energy. And remember, not all risks show up right away. Some build slowly, like low blood pressure from too many heart meds or confusion from overlapping sedatives. By staying aware and asking the right questions, you're taking back control of your health. You're not being difficult. You're being wise. So next time someone offers to update your prescriptions, pause. Think about how you feel, not just what's on the chart. After all, health isn't just about numbers. It's about clarity, steadiness, and feeling like yourself. And that's something no medication list can define for you. Getting older doesn't mean stepping aside. It means stepping up, taking more say in your care, your choices, and your peace of mind. Many checkups are helpful, but not all of them. And the ones that don't consider your age, your current health, or your goals might do more harm than good. If you've made it this far, I'd love to hear from you. Drop a comment below and tell me which of these 5 surprised you most, or what you've experienced when it comes to overtesting. And if this gives you a new way to think about your health, hit that like button, subscribe, and turn on notifications so you don't miss future videos. You've earned the right to ask questions, to pause, to say, I want to think about this. Your health isn't about doing more. It's about doing what matters most for you. Thanks for watching, and I'll see you next time.